Southcoast Health officials tell us they've implemented a stricter visitor policy due to a rise in COVID-19 cases over the last few weeks. The policy calls for visitors to show proof of vaccination or a negative COVID-19 test within 24 hours of a visit. 12 News reporter Alexandra Leslie spoke with hospital officials and explains what you need to know if you are visiting a loved one.
Dr. Dan Hackner, Chief Clinical Officer at Southcoast Health, tells me that the new policy, while stricter, was meant to be a middle ground rather than dramatically restricting visitation, as was done in previous surges. Dr. Hackner says in prior COVID surges, Southcoast Health has had to suspend visitation entirely.
We think there's an important role for visitors and family in the healing process and did not want to exclude individuals.
That's reflected in a new visitor policy at Southcoast Health, now in effect, which states patients may have just one visitor at a time who must show proof of a COVID vaccination or a negative COVID PCR test within 24 hours of a visit.
Does that exclude the at-home rapid test that you can do?
We have no way of assessing an at-home test. We don't have laboratory personnel in the front of our hospitals. So we did discuss the options there and ended up relying on the most validated and most widely available tests currently now.
Dr. Hackner says that requires a bit more coordination from visitors.
It's a patient safety and staff safety step, but also a step that will allow us to continually permit visits.
There are some special circumstances like end-of-life care, and birthing partners, if masked, can be present during the birth without negative results in hand.
Birth is an unpredictable event, usually a healthy, uneventful occurrence. And under those circumstances, we'll facilitate the testing.
Dr. Hackner says while the new Omicron variant is a concern, the rise in cases over the last few weeks have prompted the shift in policy.
We are seeing loads in the community of virus that are consistent with what we saw 9 months ago and even higher than the start of the pandemic.
Dr. Hackner says emergency rooms have been the most impacted and urges people to seek care at the right level, which may mean talking to your primary care doctor or going to an urgent care before going to the emergency department. I'm Alexandra Leslie, 12 News.